Good afternoon. Thank you so much. Our apologies that votes made us wait a little bit, but I wanted to go ahead and open up this press conference to really introduce what conservatives are coalescing around to be a conservative solution for health care concerns for Americans. And we are joined today by our Senate colleague, Dr. Rand Paul, who is obviously worked with us very closely. Thank you, Senator, and Governor Sanford, who together will put forth a definitive plan that will address the concerns that many of my constituents and constituents across the country have raised with regards to the repeal and replacement of the Affordable Care Act. The House Freedom Caucus has taken an official position to support the full repeal of the Affordable Care Act, and today takes the official position to actually support Governor Sanford's bill as a companion bill to the one that Dr. Paul has introduced in the Senate. We're excited about the fact that it will finally be able to address many of the concerns that we're hearing, whether it's at town halls or personal calls or from our constituents about pre-existing conditions, about how to empower the consumer in terms of their health care choice, and ultimately drive down the price of health care. And so with that, I'd like to turn the podium over to Dr. Rand Paul for some comments. Thanks.
As Mark said, this is a big day for conservative Republicans. We won in 2010 based on our position that we should repeal Obamacare and our concern for big government and debt. But Obamacare and repealing Obamacare was a big reason why we won the House in 2010. It's a big reason why we won in 2014. And it still was yet a big reason why we won the White House in 2016. We owe this to the conservatives around the country who elected us to completely repeal Obamacare. But I think if you're going to completely repeal something, you should replace it. And I've been a physician for over 20 years, and there are problems in health care, some that even predate Obamacare, and we are concerned with how to provide the most amount of insurance at the least amount of cost. And that's what our replacement bill does. Congressman Sanford will go into some of the details, but I'll give you three sort of principles that I talk about with it. It's going to legalize the sale of inexpensive insurance. It's going to expand health savings accounts so people can save to buy their insurance. They can use it for their deductible or their premium, for vitamins, weight loss, you name it, exercise. And it also allows individuals to join an association so that they're not left out in the cold by themselves to buy insurance in a small insurance pool. Everybody in the country, the 11 million people in the individual market, will be allowed to join an association, and these associations will give them leverage to get lower price and better insurance. And I think this is a big day for conservatives. Congressman Sanford. Sure.
Just a couple of thoughts. The first of which is I want to give credit to Senator Paul for his creation of this bill. It needs to be remembered that this is the companion bill to what he has already created in the Senate side. And so I admired his stance toward liberty and to individual freedom and to maximizing both. But I particularly like the way in which he's taken his real-world life experience as a physician and applied them to bring liberty to ultimately patients and citizens alike across this country in terms of what comes next in health care. Two, I would single out Mark and Jim and Dave and others, this band of brothers that are representing the Freedom Caucus. This is not my bill. This is in essence a work of the Freedom Caucus. The Freedom Caucus is built around this notion of maximizing, again, individual liberty and freedom. And I think that that's what this bill does. I mean, you think about this notion of advancing the hallmark of the American experiment, it's individual freedom. And one of the places that we don't have that right now is on health care. And so, you know, my dad always used to say that if you don't have your health, you don't have anything. And you look at the energy that's been in some of these town hall meetings, it's tied to, when you think about this debate, there's nothing more personal, more vital, in some cases more life and death, than one's health care. It is a big deal. It affects those of us that we love. And the Affordable Care Act was well intended. It was built around trying to correct some of the things that Senator Paul was just alluding to that weren't working right within the system, but it created some of its own problems. You know, it had government deciding what was essential, whether you and your family members thought the same. It had government, in essence, setting up non-insurance insurance, which worked against all the math of what would make a system sustainable. It never decoupled employment from insurance, which I think is a fatal flaw within the current system at large. And as a consequence, in a state like South Carolina, you see premiums that have gone up by 29%, and you see us pull down to yet but one provider. So I think that what's really represented here in this bill that a lot of folks have worked on, whether from the caucus standpoint or from the Senator Paul's standpoint, is an inflection point. This is not about replacing the Affordable Care Act or Obamacare. This is about where do we go next in terms of health care so that people are in control. I think that fundamentally in life, there's nothing more frustrating than being in charge but not in control. But if you really think about the paradigm that's represented in health care, fundamentally, all of us as healthcare consumers are in charge but ultimately not in control. And what again, Senator Paul has seized on is this notion of how do we put the consumer back in charge and in control of what comes next. I think that this bill, like no other, empowers the consumer and creates a marketplace. If I was boil down the whole bill, that's fundamentally what each one of its line items are about. How do you empower the consumer so that a patient in consultation with their doctor is able to make the decisions that they believe to be best for them and their family? And how do you create a vibrant marketplace so that you have real choices out there? I think that there are a couple of things that, again, stand out. One is severing employment from health insurance. Is your home insurance tied to your job? Is your car insurance tied to your job? It's not. And yet, with employment, we have it tied to health care simply because an anomaly of history. And that was the wage and price controls of World War II. And it was in 1948 that the two got coupled as a way of getting around the wage and price controls that existed in World War II. And it's been forever linked, and it's created a fatal flaw within our health system. So I think that what Senator Paul has gotten at, what the caucus is about, is saying, wait a minute, this is a fundamental flaw in the way that we deliver health care these days. Might not we change that? It's about that. It's about affordable plans, as the Senator just mentioned. It's about robust HSAs. It's about, I think, a correct way of dealing with pre-existing conditions. Does. It's about pooling and a whole lot more. But before I talk too much, I will hand off to Emeritus? Do I say Emeritus?
No, don't say that.
No?
I think you sound way too old. Look, the American people have had it. They are frustrated, and they're frustrated because you got to remember the framework. They were told 9 different lies when this thing passed. Like your plan, keep your plan. Like your doctor, keep your doctor. Premiums will decline. They'll decline on average $2,500. Deductibles will go down. Website is secure. Website will work. Emergency room visits will decline. They've actually increased. And they were also told these 23 co-ops we're going to create are going to be the cat's meow. 18 of them have already went bankrupt. So everything they were told about this law turned out to be false. And it's in that context where they're looking for a cure and they're tired of waiting. And frankly, so are we. And that's why this week, under Chairman Meadows' leadership, you saw our group take 2 positions. 1, repeal it now, and use the bill that's already passed, the House and the Senate. Take the 2015 legislation and pass it, and then put in a replacement bill the kind of things that are going to empower individuals, empower consumers, empower doctors, and not empower Washington like Obamacare does. Pretty simple plan, long overdue, and frankly, as I said, we were tired of waiting, and that's why we took the position we did and said, let's go. Let's go now. Let's do something we know can pass on repeal. At the same time, let's put forward this replacement legislation, which does just what the governor said and what Dr. Paul said, empowers people and actually creates an environment for freedom and market choice, which we think in the end will lower health care costs and help the families that we're trying to help and that we told we were going to help and we told we were